Okay, I want to wrap this conversation about osteopathic medicine up with the current status of osteopathic doctors in the United States. So currently, osteopathic doctors are licensed in all 50 states, and they essentially have the same practice privileges as MDs. The vast majority of osteopathic physicians or doctors are going to be practicing as general practitioners. However, some of them do specialize and they go into areas like anesthesiology, etc. But for the most part, I would say the majority of osteopathic physicians are practicing as general practitioners. If somebody's interested in becoming an osteopathic physician, they have to have a bachelor's degree with a high GPA. They have to take the MCAT and get a competitive score on the MCAT. As is the case with most medical programs, whether it's physician's assistant, nursing, MD, DO, there's going to be preference given to those who have some sort of relevant medical experience, like they've been volunteering in a hospital or something along those lines. And then, of course, they're going to apply and then be granted interviews at osteopathic medical schools. And part of that interview process is going to be, pointed towards why they are interested in becoming an osteopathic physician rather than a medical doctor. So, of course, it would be good to know if this is something that you're interested in potentially pursuing. It would be good to go into that interview, like knowing something about the philosophy of osteopathic medicine and how it differs from allopathic medicine and sort of work that into your interview. There's currently 33 accredited osteopathic medical schools in the United States. There's a bunch of different professional organizations, but probably the most well-known is the American Association of the American Osteopathic Association. This is their website. I'm going to give you an assignment where you're going to get to kind of dive through this website a little bit and see if you can glean some information. But there's quite a bit of information about this particular association. Talking about legislation, if you're a medical student, the different things that the osteopathic physicians do. So we'll get to have you look through this a little bit as your assignment. Okay. Oops. Excuse me. And then after medical school, there's going to be postgraduate education, which is going to consist of internships and residencies. And there's all sorts of different sorts of residencies and, very similar to what an MD would do once they finish their 4 years of medical school and they go into their clinical rotations. It's sort of these rotating internships to get some experience in different sorts of practices. And then there's also research. Some osteopathic physicians go into research, but I would say the majority of them practice. So here's some additional sources of information different from the one that I just gave you. So if you're looking for additional information about osteopathic medicine, you can look at the American Academy of Osteopathy, the World Osteopathic Health Organization, and the Osteopathic International Alliance. One thing I will say is that in different countries, so osteopaths practice in different countries as well. It's not just an American profession, but the osteopaths, their scope of practices are different in different places. I was at a conference recently where I met an osteopath from New Zealand, and she operated much more like a chiropractor. So they didn't have the same scope of practice. And in Europe, I believe that's similar. So they don't have the same scope of practice. They're a lot more limited. And it seems like they're much more, their practice is much more geared towards manual medicine, right? So they do a lot more manual medicine. And they are expanding into, again, similar to what we see with chiropractors, into areas like nutrition and, supplementation and all of that, but they don't seem to have that same sort of scope of practice in other countries. I think finally I have a little infographic here that kind of is gives you a comparison between the two. So essentially you can see that, and this is geared towards more selecting a physician, if you should select an MD or a DO. Like I said, they are more or less very similar, especially in sort of as the entry point, as a general practitioner, sort of the gatekeepers of sort of general practice. They're going to practice very similarly. The scope of practice is similar. The education is similar. They have to practice licensing exams. The licensing exams are a little bit different. And I'm going to post a YouTube video that's an interview between somebody who has just graduated from somebody who's a medical doctor and someone who's just graduated from osteopathic school. And she kind of talks a little bit about the licensing and the different licensing procedures for those of you who might be interested. And again, you remember that the DOs should receive some additional training in manual medicine. And so in my experience, that makes osteopathic physicians very valuable. But one thing you do have to know is not all osteopaths, and I would say almost now it's a little bit more uncommon for osteopaths to be practicing manual medicine. So that would be a question that you would want to ask if that's something that you're interested in. Like I said, I think that that's a great addition because it adds like a whole nother level of functionality, if you will, to your primary care provider. But you're not always going to get somebody that's going to continue on with their osteopathic manipulation or manual medicine after their residency. All right, so that is kind of it. I wanted to kind of give you a idea on a case study. So I have a case here that I'm going to kind of run you through. Actually, I'm going to do a separate video on this so you can see, I don't have a slide and it'll be easier if you see the words. So on the next video, I'm going to do one case study of potentially how an osteopath would approach a patient in a primary care setting. So I will conclude this video now and we'll pick up the very last one with a case study.